The Disruptive Dozen is a rank-ordered list of 12 closed-to-market cutting-edge technologies that leading Mass General Brigham faculty feel will have the greatest impact on healthcare in the next 18 months. Number 12. Reducing the burden of prior authorizations. The U.S. spends more on healthcare than any other country, and yet health outcomes for Americans are not substantially better than those for other countries' citizens. In many cases, they are worse. To help control the costs of care while ensuring quality health care, payers in the U.S. often use an administrative tool known as prior authorization. It requires physicians to first obtain approval from insurance companies for certain medications, tests, and procedures in order for them to be covered by patients' insurance plans. This check is intended to flag inappropriate or excessive treatment and help reduce unnecessary healthcare spending. While the idea sounds simple, it is complicated and burdensome in practice for both physicians and payers. That's because prior authorizations are largely manual, involving phone calls and faxes between the necessary parties. They can take days and sometimes even weeks to complete and result in delays in care, which can harm patients. According to a recent survey by the American Medical Association, nearly 1/3 of physicians believe prior authorizations jeopardize patient health. Now, efforts are underway to streamline and automate the prior authorization process. That includes standardizing the data that must be shared between healthcare providers and insurance plans. It's also transmitting information digitally, directly from patients' electronic health records. End-to-end automation will save time and money, approximately $450 million for the healthcare industry. Even with these enhancements, momentum is building to overhaul current healthcare policies and move to eliminate prior authorizations, particularly in light of the harm they cause to patients.
Recent years have seen a sharp rise in procedures subject to prior authorization, inappropriate delays of prior authorization decision, payment denials for medically necessary care, and unilateral changes in the rules for both patients and clinicians. These developments have increasingly blindsided patients seeking to obtain necessary medical care, who often learn, after needing medical attention, that their plans offer less coverage than they thought, or that plan details were altered without their knowledge. In addition to the direct impact on patients, these evolving health plan processes equate to hundreds of billions of wasted dollars each year as the administrative burden of managing a chaotic process continues to grow. The current prior authorization platform is cumbersome because of the variation in submission process, unreasonable and unrelated requests for additional medical documentation, denials of unanticipated but medically necessary care, and cumbersome appeals process. Clearly, our system can serve patients and clinicians much better than it currently does. Patients and clinicians who care and the clinicians who care for them deserve a rational, predictable, and efficient system in order to ensure access to the highest quality care. A critical part of this work includes direct digital transmission of patient data from the electronic health record. Furthermore, we need to standardize prior authorization requirements and processes, including formatting communication services subject to prior authorization. While health plans generally provide lists of services subject to prior authorization via their websites, it can be challenging for providers to locate the right list for the right plan and keep up with any changes, especially when the health plan and their vendors provide inconsistent information. Proposed formatting initiatives will result in adherence to a standard format for posting prior authorization requirements, provide accurate staff contact information for follow-up, and ensure oversight of vendors. This information can now be conveyed within a clinician's information system, which will ensure that he or she knows when developing a treatment plan or prescribing something whether or not prior authorization was required. Formatting for prior authorization requests and responses will also lead to standardization in using the electronic format, including submission of clinical documentation and return response in the same way. The current initiatives also will allow us to have better capacity in terms of access to 24/7 prior authorization capabilities. It will also lead to a timeliness in responses. Similarly, all health plans will abide by the same timeframes for responses, proposing that 72 hours for certain scheduled non-urgent services and 24 hours for urgent services. Finally, the current initiatives will seek to have full and complete denials delivered to clinicians and patients in a timely fashion so that plans will be asked to communicate denials in writing immediately and transmit them electronically to allow a timely appeal process to ensue. Implementing standards in the above areas is going to lead to a reduction in the significant administrative burden associated with prior authorization, as well as the cost over time, and will better ensure that patients receive access to the services they need. Health plans will still have ample opportunity to differentiate their products through unique constellations of clinicians, benefit structures, quality, and enrollee experience, among other aspects of coverage.